like to welcome you all today and to introduce our MC for the event, Mr. Jeff Bentley. Jeff, over to you.
Thanks so much, Gavin, and thank you for everyone attending. Obviously, the content for today's forum is obviously hits home for us a lot in Victoria, what's happening in our community, certainly the aged care sector in our community at the moment. So we've got some great speakers to go through. We might just start off a little game. I've got a couple of bottles of wine to give out, quite simple questions you should be able to answer. In Victoria, as you know, September is the greatest month for all the events that we have. Obviously, we have the biggest event in Australia is the AFL Grand Final. Unfortunately, that won't be played at the MCG at the Holy Grail this year. If you could, first person to tell me where the Grand Final will be played, will win a bottle of wine.
Put your answers in the chat there. Oh, Matthew Moy and Graham Wickenden. Wow, that's very quick.
Okay, well I thought that'd be a quick answer, so well done.
I think that's Tim Scott, I think. Tim Scott.
They came in pretty quick, so we might have to give out a number of bottles of wine. So we've got them covered. We've got one other one. One of our, it's Who Am I? One of our keynote speakers, very much an entrepreneur. He graduated for honours from his school. Him and 7 friends decided on a flip of a coin whether they'd all go into medicine or law. They decided to go to the Mighty Inflation nightclub in Prahran, flipped the coin, and they all became doctors. Can anyone tell me who that person? Yes, Alison Lees. Alison, you can't win laptops, you can't win bottles of wine, but you are correct on that one. So that is Leo. And on that note, we will start the program. Please, if you could also, we want this to be extremely interactive. And I do actually want to firstly acknowledge our sponsors, because you always lead events for this, and we acknowledge all our sponsors for supporting us. Certainly Cinex, well done Cinex. Okay, all right, our first speaker is Dr. Lior Roshberger. Now, Lior is no stranger when it comes to the aged care sector. He's the CEO and founder of MyDNA. It's a product that we introduced in the aged care sector a number of years ago that would measure what goes through the liver, and we determined this could be a really good option for the aged care industry, where as the elderly get in, they have a number of drugs and the side effects related to those drugs. We had detailed medication that the pharmacogenomics would measure through Lior's organisation. Would give you maybe that little bit more percentage of being able to spend more time in the common area. So it's a great initiative, and I know a number of aged care providers will take that as part of their onboarding process. So without further ado, I will invite Lior to talk about his topic. We'll be talking about what's happening in the marketplace at the moment in MyDNA and coming up for an antibody to combat COVID-19. So over to you, Lior.
Thank you, Jeff. Can you hear me clearly?
Yes.
Wonderful. Thanks for having me. And we certainly are living in very unusual times. So I've prepared a few slides that I'm going to talk about. I'll just share them now, and that should pop up now. So I'm going to talk about the importance of genetic technology in winning the COVID-19 war. I mean, there is so much that is still not understood and not known about this simple coronavirus. And I think a lot of the uncertainty and the fear and to some extent some of the hysteria is just caused because of the unknown. Yeah? And obviously, as time goes on, we're understanding more and more about the virus. And I think the knowledge base has really moved significantly since the beginning of the year, since February and March, when it first started moving out into the Western world. And genetics has and will continue to play a really important role in understanding the virus, how it spreads, who is susceptible, creating a vaccine, and all the things that are dominating the news cycle at the moment. So I'm going to go through half a dozen slides, and we'll save some time at the end for any questions. So the first thing I want to talk about is that the coronavirus, or COVID-19, was fully sequenced faster than any other virus in human history. I mean, medical technology has advanced so quickly that I think it was a matter of 2 or 3 weeks before the whole genetic profile, the whole genetic structure of the coronavirus had already been sequenced, which is quite extraordinary. And that's when they started to have some insights that it started from bats initially, and then they're still trying to exactly nail down what was the intermediate host for it to get into humans, and that will still be understood. But really understanding the sequence of the coronavirus has been important on so many levels. And just so you understand, the coronavirus is actually an RNA. It's made up of RNA molecules. We hear about DNA a lot. So DNA is obviously the building blocks or the blueprint in every human being. DNA has a cousin called RNA. It's kind of like a first cousin. And the coronavirus is actually an RNA virus. I mean, other viruses are RNA viruses, like HIV is an RNA virus, but there are some viruses that we get that are actually DNA viruses, but coronavirus is an RNA virus. And basically, it's not a huge sequence virus. You can see there at the bottom of this slide, there's actually 30,000 letters that make up all the blueprint of the coronavirus. In distinction to us all as humans, we don't have 30,000 letters. We have 3 billion letters. Yeah, so it's 30,000 in the RNA coronavirus, 3 billion from each parent, I should add, in a human being. So it's quite simple, but very conniving nonetheless, right? And so genetic epidemiology is really, you hear this word epidemiology, we're relying on the scientists and the epidemiologists to help us determine the public health response. And it's all about these things, yeah? What makes up the virus? Is the virus changing? How is it being transmitted? So clearly, if we have clear answers to those 3 pertinent questions, we can respond better, we can make policy decisions better, we can know when to get in and out of lockdown better, which is quite a controversial point, and I won't start on my little rant on that one at the moment, but genetic epidemiology is fundamental to be able to understand and respond efficiently. And genetics has been, as I mentioned earlier, it was sequenced really quickly. As soon as it emerged out of Wuhan, a few weeks later, back in January, the virus was sequenced. And then as it became a bit of an epidemic into February, as it was spreading across the world, they were really using genetics to understand the pace at which it was spreading. By March, it was clear that this was a pandemic. And then I've got some subsequent slides that as it's proliferated across the world, understanding how each of us respond differently to this virus is so important in being able to manage it. And genetics is playing an increasing role in that area. And so this is really about tracking the virus. If we can understand how the virus is evolving, we can track where it started, who was patient 0, and then this real-time data, and I refer to the Johns Hopkins site quite a lot because it really is the most up-to-date data of how it's spreading, the number of cases, number of hospitalizations, etc. And genetics is really guiding the public health response to this outbreak. And the way they're doing it, you might have heard, for instance, in relation to the situation Victoria is in, we hear constantly on the news that with this bungled hotel quarantine that sort of spurred on the virus. So you might understand, how do they know that it started in the hotel quarantines? Like, how do they actually prove that? And when they're actually using sequencing, if they refer to genomic technology a little bit, and I'll just sort of explain that to you. What actually happens is that every time the virus infects another host, which is us, I suppose, there's slight tiny little changes. There's a slight, what we call a mutation, where a single letter of those 30,000 letters that I described earlier might change. And you can actually easily see this. Yeah? And so it only makes one change. So by basically seeing these very small mutations in the virus from one person to the next, it can really help us know that you got the virus from that person, yeah, that you went to that pub or to that gym, or you were in that location, and the person, that helps them identify who patient 0 was. So it's small changes in the letter structure of the coronavirus from one person to the other person helps the scientists and the medical officials, trace the virus and how it's transmitting. And it's really about following the genetic trail. And the countries that have been most successful in getting on top of this virus with fantastic contact tracing and isolating programs, it's because they've used this technology to know exactly where it's come from. Yeah, let's find out who the close contacts were. Let's make sure they're quarantining quickly, and then it's not spreading into these larger clusters. So it's really been vitally important in that. If you look at places like parts of Europe, if you look at parts like in South Korea, etc., they've been extremely effective in doing this and rapidly doing that. And so just to switch gears a little bit, in this slide, what the next step is. We're all wondering, I mean, we watched the data that came out of New York and Italy when they just got completely hammered by this virus. And people are saying, well, why are some people just, barely having any symptoms to this virus and others are just being hammered and need to be hospitalized, going to critical care, some need intubation, and then some ultimately pass away from this virus. And these are sorts of the things that are now being heavily looked at, and there's a lot more questions than there are answers. But the genetic composition, not of the virus, but of human beings, and this is at a DNA level, is certainly going to start to provide indicators of why people get very sick. Other people are asymptomatic. Some people are super spreaders. Why children seem to be, less infectious or less likely to receive it. I mean, there's a lot of things that are still not clear, but doing broad DNA testing on large populations and looking for the differences to explain some of these things is really, really fundamental. And you can imagine that if we had better insights of those who were going to get very sick from this virus or exposure to this virus, and those that were likely to not be sick at all, you could be much more targeted in the way you handle your response. Yeah, you wouldn't necessarily have to lock down a whole city. Yeah, I mean, you could, even in New Zealand, which we saw after 100 days of not a single infection, I think they had half a dozen cases, and then they locked down Auckland of 1.2 million people. I mean, that is drastic measures that is damaging so much of the economy, that if we had these kinds of insights genetically, we could be much more targeted in our response. And then finally, well, I've got a few more slides, but what I want to sort of move to is sort of talk about gene-based vaccines. Yeah, and look, we've never had a vaccine to any coronavirus, which is a little bit of a sobering thought given where we're all at. But there are, and this number has certainly grown, but there are literally now over 100 companies all across the world. We hear about the one in the UK. We've got some research happening in Queensland, and they're all working very hard and with significant resources at disposal to try and find a vaccine clearly. And what's interesting is that the traditional way to make a vaccine is a very long and arduous process, which you can see there on the top. It's a traditional approach. I mean, I think if you look back, the average length of time to develop a vaccine over the last 50 or so years has been 6 to 10 years. I think the average is 8 years to get a full vaccine that's fully researched through all the trials are. Now, we're trying to truncate that 8 years into 8 months or 18 months, yes. And there's some of the newer approaches to develop these vaccines where engineering the RNA in the vaccine and deactivating it is absolutely shortening that cycle to create a vaccine. Now, it won't be clear, there are quite a few front runners. I think there's a half a dozen front runners around the world in making a vaccine. A few of them are using the traditional approach. Others are using a more genetic engineering approach, which is certainly fast tracking it. It'll be very fascinating to see which of these emerge as the winners. But at the moment, it's just all about time to market, yes? And that's really important. So, and then finally, and this is really this would be the nirvana in terms of how genetics could play a role in our response. And this is the field of gene editing. Gene editing is an emerging field. It's playing a role in agriculture and other areas. It hasn't played much a role in humans because it's fraught with ethical, moral, legal, it's a quagmire of issues around that. But in the future, and this is a time away, there's a new technology called CRISPR, CRISPR, which is effectively genetic scissors. Where we're basically cutting into the genetic code in our cells and identifying that if I swap these letters or I cut out that genetic mutation, can I change how people respond? And you can see there I've shown that in the future, we can hope that using this technology, that it may be possible then to render someone immune to a particular virus. In fact, using CRISPR technology, there's already been some scientists from China who are controversial found if I manipulate this code in someone's DNA, I'm going to make them immune to HIV virus, yeah, which is another RNA virus. So in the future, we'd love to be able to make them resistant, or even if they're not fully resistant, to make sure that coronavirus, you don't have that enormous immune response, which ends up people being hospitalized, becoming very unwell. So these are some of the technologies, whether it be from tracking, surveillance, forming a vaccine, editing genes to confer susceptibility. Genetics is playing an enormous role in our fight against COVID-19, and there is no question that as time goes on, it will play a greater role, and hopefully we'll get Melburnians out of lockdown sooner rather than later. I think that's all I've got to say in terms of the formal slides, Jeff and Gavin.
Okay, we'll just throw to the audience and have some questions. I think Pete Gunn, did you have a question there, Pete?
If you've got a question, Pete, just type it in the chat.
I've got a couple here anyway to start you off. In the event a vaccine isn't available for many years, what role will genetics play in living with COVID?
Yeah, so I think it's related to some of those topics I've discussed. Yes, I mean, look, the challenge we've got here is that all our politicians, and this is not just at a local level, this is at an international level, they've sort of got plans that where we're going to lockdown and the stages of restrictions, and they're talking about other systems, but it's all very short term, yeah. And they're all, I imagine, just hoping that a vaccine comes, yeah, and then they'll say, okay, great, we suffered a bit for 6 or 9 or 12 months and we're out of it, right? But the reality is, if a vaccine doesn't come or it's not that effective, we need to be able to live with COVID. How are we going to live with COVID in a COVID normal world, just like we live with influenza and just like we live with lots of other viruses? And I think we've got to start talking about that. Why I think genetics will play a role in that, I think it'll help stratify people that are at high risk, low risk, and medium risk. And clearly, if you knew you were high risk, you could act differently and behave differently and take more preventative measures than people that were low risk. I think that'll be really helpful. I think it's also going to helpful in speeding up the testing process. Like currently, it is a genetic test where you get your throat swabbed, yeah, and it goes off. That's the gold standard in testing. It still takes too long, yeah. It's taking up to 24 to 36 hours, and when cities have been inundated with tests, it's taking up to 4 or 5 days to get a COVID positive or negative result, yeah? Advances in genetic technology and sequencing will allow us, hopefully, to go to the airport, yeah, have a test, get the result within minutes, and then I can know whether I can board the plane safely or not. So I think there's lots of ways in a COVID normal world, just like we live in a influenza normal world, that this technology will support us, yeah.
I've got a question here. How realistic is the spin coming from the USA about having a vaccine before the end of the year? Truth or Trump propaganda?
Well, without getting too political, I think Donald Trump, he promised that there'd be a vaccine in 2020, didn't he? He said, I promise, yeah. But, well, look, it is possible. I mean, there are billions and billions of dollars being thrown at this, yeah, and there are 2 or 3 groups, including one in the US, that are in phase 3 clinical trials, which is the last phase of trials, where typically you would need to test this on 30,000 people, which is what they're doing. So that's quite good. You know, they've been through phase 1, phase 2, phase 3. The reality is, if everything goes well in those trials and all the safety and efficacy data pans out like they're hoping it will, but, you know, it's a real test in phase 3, because having some good safety and efficacy data in a small trial in some monkeys is very different to doing on 30,000 humans, yeah? So I suppose, Gavin, in short, if everything worked out well, yeah, and you need a bit of skill and a lot of luck for that to happen, we could have a vaccine before, you know, around Christmas time. But if I was a betting person, I think that is less than more likely, yes? I think there will be a few snags, a few detours, a few potholes. They might have to change parts of the vaccine and go again. So, look, I am as optimistic as anyone that we can get out of this mess, but it is possible. I don't think it's probable, in my humble opinion.
Okay, we've got another couple here. From your perspective, what are the non-negotiables for reopening Vic without jeopardising everything again? Compulsory face masks, social distancing, keeping schools closed?
Yeah. Look, I think you know, it's a really good question, and it's very hard. And my opinion, actually, Gavin, may not be very popular. Yes, I think whether we like it or not, we have to have the hard discussions, yes, about what's an acceptable amount of illness in the community, yes, then like what we do everything. And these conversations happen all the time. I mean, we have health economists that decide all the time with who gets a particular cancer drug, yes? And that, you know, they're not going to spend, as sad as it is, because it is someone's grandparent, we're not going to spend $10,000 per dose to give a cancer drug to someone who's in their 90s who doesn't have a lot of quality of life years left, yeah? These are decisions that have been going on for decades, yeah? Why there's none of this decision making or discussion or narrative about coronavirus, it's a little bit because of all the hysteria, yeah? I do feel that we have to open up. We cannot just keep locking down. It's just, I think we are now in a position, particularly in Victoria, where decisions are being made with no perspective or balance, yeah, where it's just complete lockdown. I know it's very popular because we've been, you know, there's been a lot of hysteria and fear around the virus. And don't get me wrong, you know, I have parents who are very high risk, yeah, who I think they need to look after themselves and lock themselves up. But I think most of the population has to go and live, right? So, you know, I think we, you know, they, in the beginning of this thing, they said, we just want to flatten the curve and make sure we can keep the hospitals going for those of us that are unlucky enough to get sick, can get good hospital care, right? And we didn't know much back in March or April, but we have now had months here, and we're now near, you know, we're now in September. You know, the hospitals have plenty of capacity at the moment. I think there are only, I'm not sure how many numbers, but there's well less than 100 people using critical care beds in Victoria, and we have thousands of beds available. So, you know, I have a very controversial view on this. I think we need to open up quicker. I think we need to be sensible. I think we need to continue wearing masks and socially distance, because that's shown scientifically to make a big difference. But we just can't shut the whole economy down every time there's 100 or 200 cases. It's not sustainable. Yeah? And I think kids should be back at school. I really do think they be back at school. I think it's doing a lot more damage. You know, we can't have situations where the cure is worse than the disease. Yeah, and that's the balance I'm talking about. And I think we've got to recalibrate a bit, in my opinion, Gavin.
Okay, we've got one here from Tim Scott. What are your thoughts on vaccination penetration, considering there will be no long-term data available on any issues with a vaccine?
Yeah. No, I mean, that's a fabulous question. And this goes back to my original point that we're going to have a plan to live with COVID, whether we like it or not. Yes, we're never going to really beat Mother Nature. I don't think it's ever been done before, and I think we're going to start now, despite all the medical technology. I mean, I believe that, I don't know the exact figures, but typically they say, you know, it's got to be around 75 to 80%, yes, to actually then, at a population level, to actually have, you know, that's enough, what they call herd immunity, such that we can then just really open up. But yes, without that long-term data, we don't know. And that's what I find quite frustrating. I mean, a lot of our premiers are making decisions, yeah, then they say they're taking the best health and medical device and it's based on data, but the reality is there are no randomized controlled trials with anything got to do with COVID. So a lot of this is very subjective, yeah, and instinctive. So, you know, I do think, though, that, you know, I think Australians will seriously embrace the vaccine. We have very high vaccination rates for other things in this country, and I think that's fabulous. The quicker we do this, we get to that sort of 60, 70% level. Particularly, they'll clearly start with those that are elderly and that are vulnerable and that have pre-existing medical conditions, and then we can open up much quicker. But I think we need to be opening up regardless, to be quite frank. But I think it's about that 75% mark.
Cool. Okay.
I've got one here for you, Leo. What are the chances that another virus mutating, for example, SARS and then swine flu, can this happen again?
Oh, there's no question this will happen again. I mean, there's no question. We've been very lucky with coronavirus because it has not, it hasn't mutated significantly since February. So that's why the vaccines are looking to be quite stable, and that's really encouraging for us, really encouraging. But you know, we've had lots of these viruses, yeah. And the reason corona, I mean, I think the 24-hour news cycle and all the clickbait associated with that has blown this to a proportion that we've never seen before. And because no one had ever been exposed to this virus, yes, it's clearly a lot more infectious than other viruses that we've had. But so there is no question that we will have, this will not be the last, epidemic or pandemic that we're going to see. At least now we'll be better prepared. And if you look at the countries in Southeast Asia that were exposed to some of these other viruses, in the last 20 years, look how much better they have handled them. Yeah, they had systems in place, they had systems, they processed, they activated them quickly, they did aggressive contact tracing, and they barely skipped a beat. You compare and contrast that to countries in Europe and United States where it's been a real train wreck. So there will be more to come, but at least we'll be a lot more aware and prepared.
Okay, there's just one. It's more of a topical one. So it's how do we then handle the aged care industry? We cannot continue to totally lock down, isolate people, whereby families are unable to visit. I appreciate this is a difficult balance.
Yeah. Look, I agree. What I'm really hopeful on is that as the science matures and we understand more and more about how this virus transmits, how far away you need to be from someone to protect them, how many minutes you need to be in contact with them to actually increase your risk of transmission. At the moment, we know none of this really. So it's just lockdown, keep away, and then everything else has no balance about it. Yes. And I think, there's a lot more suffering going on, denying people the right to visit their relatives. We hear all these terrible stories of people being can't even cross the border to get healthcare, which is just outrageous. I'm hopeful that sooner rather than later, even if we don't have a vaccine, we'll understand a lot more about how this virus behaves. Yeah, what is higher risk activity and what is lower risk activity, and then we can go and visit our relatives, safely, who are in aged care facilities, because we know how long the visit needs to be. How far away we should be from them, and we can spend time with them. Now, I'm not saying we're going to be hugging them and coughing on them, clearly not, but I think at the moment, because we don't have any data, it's just worst case of everything, and it just doesn't need to be that. And I'm sure time will show that there's some things we've done over the last 6 months which just make no sense. They just have not had an impact, but we just don't know yet. So it's the best response I've got at the moment, Jeff, for that tricky question.
Okay, I've got one last one from me, which I think we mentioned last time when we had a session. You mentioned that the typical turnaround to coming up with a vaccination is on average about 10 years. Is that correct?
Yeah, it has. It's been 8 to 10 years. That's correct, Jeff. Historically, yeah.
So if Donald Trump or Putin came up with a vaccine this year, would you take it?
Ooh. Well, I'm definitely not lining up to have that vaccine that the Russian has already put out, because they haven't even gone through phase 3 trials. They've just gone, from a few monkeys and a few, like 20 people, and start immunizing their population. But fortunately, we don't live in Russia, though we're pretty close to Russia at the moment, living in Victoria, I would say. We're not that far off from being under martial law, but look, the answer is it's all on the data. It's all about the data, Jeff. So if there was a successful phase 3 trial that was peer reviewed on 30,000 people and everything else ticked the box, I probably might wait for a month or two and then have it. But yeah, I'm pretty trusting in they have the best minds in the world working on this. So I would, but it has to pass all the safety trials like all the other vaccines have done, and with very clear, compelling results in the way that they've run that. So I will embrace it pretty quickly. Yeah. And look, I'm fairly low risk because I'm, in my 40s and have no existing conditions and in pretty good shape. So I'm not particularly worried at a personal level about this virus. Yes. But clearly, the people in aged care homes and the people that are more vulnerable would have it. But I would, Jeff, I would. In Australia, if it got through the regulators in Australia, we're very conservative in this country. I would go straight and have it. I would. Yeah.
Lior, we've got one here from Ian Goldsmith, and he's asked it twice. So, are the fatality numbers distorted because people are dying with the virus and not because of the virus?
Yeah, Ian, yes, you're absolutely correct. They are absolutely distorted, and I think this is a little bit part of the hysteria. Yes, I mean, the reality is, and sad as it is, when they report that, I heard our Premier say, we're sorry to report that a 101-year-old died of coronavirus, a little while ago. I think a lot of these people, sadly, they were ended their life anyway. Yeah, and to be honest, if they, they're in such a frail state, they don't have a strong immune system. If they were to acquire any virus of any kind, yes, they may have passed on, as sad as that is. So I do think those numbers are heavily distorted. I also think that we don't really know the denominator of the mortality rate. So they might say that 500 Victorians have died out of this total number that have been infected, but I think the total number infected is much, 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 much higher than what we actually think it is. Yeah, they did a study in one of the boroughs of New York where they actually officially thought that, I think the figures were 35% of people living in this area officially had a positive COVID response. When they looked at the antibodies on these people, it was nearly triple that. So, if you increase the number of people that have got exposed and you think the mortality rate is 7%, and it's actually 10 times the amount of people actually had the virus, that it's not 7% mortality, it's a tenth of that. Yes, it's 0.7%. So I do feel in time, when the dust settles of this craziness, that look, it is a nasty virus, and a lot of us, or none of us have been exposed before 2020. But I do think when the dust settles, the numbers will not look anywhere near as bad as they appear to be on face value today. That's my opinion. Yeah.
And I think we've got one more. This is a yes and no answer. Okay. Yep. My team are trying to set me up here. Okay. So, because they know I can't say this, is Lior taking hydroxychloroquine? Hydroxychloroquine.
No, I am not taking hydroxychloroquine. No, that is something I certainly wouldn't do. And I think it's only been found useful in people that are very unwell in critical care. Yeah, I'm not sure there's a lot of evidence that as a preventative, despite Donald Trump taking it. No, I am not taking it, and I would not take it. No, I would not. But it's been around forever. It's been a malaria drug for decades. It's a fairly innocuous drug, but the answer is no.
Okay. All right, Lior, as always, great presentation, very topical, and the line of business is certainly fantastic, and it's always interesting to hear you present and talk. So thanks very much, really appreciate it. And for everyone's knowledge, this has all been recorded, and we will be sending you a copy of the presentations that all the presenters come up with. So we might move on. The next speaker is Emily from Sign, and I'll give you a bit of background here. Sign is basically delivering a sign-on process for aged care centres. Now, in the education sector, where you've been using Sign for many, many years, and they're a proven and reliable and stable product, with how the environment is in the aged care sector, it's obviously a natural fit to bring this product in there, so we can put a little bit more protection for visitors and staff coming into an aged care environment. But please note that Sign have been doing this for many, many years, and I know there's a lot of upstart companies that look at an opportunity and bring all this into place, but I just wanted to put this, there is a lot of credibility from this organisation that has been doing it in other sectors for years. So without further ado, I'll hand over to Emily and look forward to her presentation. Thanks. Over to you, Emily.
Hi everyone, and thanks Jeff for the introduction. So on our end here, you've got myself, Emily, from the partnerships team, and my colleague Michael, who's out of the screen right now, is joining as well. He's the head of our enterprise team. So as Jeff mentioned, we've been around for, a really long time now, in terms of startup culture, and education sector wise, we're the largest provider of visitor management across schools in Australia. As soon as COVID started to hit, we noticed that the industries that were adopting us started to change a little bit. So whilst we still obviously have our huge presence in schools, we were starting to get contacted by aged care facilities, big hospitals, that thought that our solution would be helpful to their industry. So I'm going to go ahead and share a quick presentation with you to give you a bit of an introduction about what we do and a bit about Sign. Cool. So as I mentioned, we're an Australian-based startup. So there's about 70 odd of us now, with our head offices being in Adelaide. So you've got our sales, marketing, entire engineering, product team, all based in Adelaide. We've then got a support team in the Philippines and also some offices in Los Angeles. So a little bit about our value proposition I wanted to start with as it relates to COVID. So the main things we've really been focusing on are those pre-screening. So once a visitor arrives to a site, whether that's a contractor, general visitor visiting a family or friends at an aged care facility, even staff, we can pre-screen them with COVID type questions. So some of the key ones we're asking is symptoms, visiting hotspots, and depending on what answer a visitor provides in that check-in process, you can approve or reject their entry to a site. So if someone's answering those questions that in a way that poses a risk, a notification can be sent to a host that looks after a site to then review the answer and approve or reject. Obviously, a big thing has been working from home in the new COVID scenario. We can facilitate checking people into working from home sites, so you can still keep track of your workers just in a working from home basis. Contactless check-ins as well is a big one. So I've got a demo to show you shortly on how that works, but we really listened to feedback that was coming in from our clients. And one of the biggest things was around the contactless check-ins. So people don't want to necessarily physically interact with an iPad Surface given the COVID situation. So we've created some contactless check-in solutions. And to go along with that, we've also got sanitizer packs that sit along with a lot of our kiosks so people can sanitize their hands before and after checking in. Thermal screening, which I know has been a really popular one at the moment. It's just really taken off. So our engineering team have been working really hard on an integration to work with those thermal cameras. So once visitors are coming to a site, they can have their temperature read. It's then pre-filled into our check-in forms, and you can reject or approve a visitor's entry based on their temperature. I'll talk a little bit about everything else throughout the presentation, but we've also got apps available. So one of the main ways you're checking in with Sign is via an iPad, but we've also got an app solution, which is where we can geofence a site to make checking in and out automatic. So I guess where that's been really helpful is a lot of our construction sites, for contractors to be able to sign in and out without even needing to do anything. They're just checked in with the geofence, and really helpful for those big buildings in places like Melbourne and Sydney when they are at work to know exactly who's coming and going from your sites in a given day or within a given time period. So some of our key clients, because I think this is important to note. So we've got probably more now than 40% of the ASX on our client list. Some of the key ones really are companies like Coles, Woolworths have rolled us out to all of their distribution centres. New South Wales Government, we're in probably thousands of sites now with them. But as it relates to the health sector, you can see here we've got like the Royal Adelaide Hospital, the Royal Children's Hospital in Melbourne, the Royal Melbourne Hospital, and then on top of that, a lot of aged care facilities as well. Our check-in volumes, they're pretty huge now. We're supporting really large volumes, 50 million check-ins to date, check-in and outs to date, which is just huge. So to focus further on our key client focuses within hospitals and aged care, as I mentioned, you can see here a picture of the Royal Children's Hospital. So they've probably got about 8 kiosks in their foyer now. So anyone that's coming through the Royal Children's Hospital for visits needs to check in with Sign, and then they're having a badge printed, which they wear around the site, allowing security teams to know that they've gone through those screening questions and they're cleared to be on the site that day. Government health sectors have been really huge for us as well. So we're across Queensland Health, SA, New South Wales, Victoria. So going into a quick case study around the Royal Children's Hospital, you can see they're checking in a range of different visitor types. So we're not restricted to just simple visitors and contractors. You can be really creative with the types of visitors you're wanting to check in. So you can see here we've got inpatients, outpatient visitors, etc. And the volumes here are huge. They're checking in 1,000, if not more, per day. So I'll go into the contactless check-in example shortly with you to show you what that one looks like, and also to give you a visual of what our solution looks like. So as I mentioned, we can have those sanitizer packs sitting next to the kiosk to allow visitors to use that before and after checking in. The COVID screening, so once a visitor's coming to check in, we've got our own artwork that we're using. So if clients are deploying with Sign, we can easily help with putting this together. Otherwise, a lot of companies will have their own sort of marketing material that they want to upload to those check-in forms. But if you use the Sign one, this is a little bit about what it looks like. So we can present some information around hand washing, hygiene, and we can have visitors agree to that they understand those requirements when they're visiting the site. So they're answering yes or no questions to respond. The thermal cameras, because I know this is a really popular one, so I'll give a little bit of a background on how this works. So there's a camera that's sitting in front of the iPad, and as the visitor's checking in, they've typed in their name, their contact details. The entire time, the thermal camera is taking an average reading of their temperature. So by the time they get to the check-in form, the check-in form's pre-filled with that temperature that they've recorded, that average temperature. And only if it's under, say, you can actually set the temperature that you want it to be under, and only if it's under that amount will they be able to check in. Otherwise, as I said, we can reject that check-in event. Contact tracing, absolutely huge. So there was an outbreak here in Adelaide. Whilst we've fared pretty well with coronavirus, there was an outbreak not too long ago at a couple of our schools, and luckily those two schools were using Sign. So when it came time to understanding who was on their sites in those days and timeframes, they were able to go in and pull some comprehensive reports with Sign to not only look at who was on site, but also their contact details to get in touch with those people to let them know that they needed to get tested and quarantined. As I mentioned, we can geo-fence the location. So iPad check-in is one option, but when it comes to checking in visitor types like contractors and staff that are constantly coming and going, they can download phone apps to be checked in and out of their buildings or work sites automatically. This is what those badges will look like. So once a guest has been cleared to come into a site, you can print them a badge to wear around. Cool. I'm going to jump in now to a really quick demo, and that will be pretty much it from my end, and then I'll open it up to some questions. Cool. Confirming we can see the iPad screen there, guys. Yep. Awesome. So this is just a general demo site that I've put together. Would of course brand it up to the specific client that we're working with. You can see a few things on this first page, obviously the photo, but also in the corner here, we've got this fast track code scanner. So if you know that visitors are coming to site in advance, you can go into the Sign dashboard, program in an invite for them, and they'll be sent a QR code, which they can come check in with. So I'll show this to you. I've sent myself an invite for this site earlier. Go ahead, scan it in, and the key to this is it's contactless, so I don't have to do anything. I need my photo in the view to do this. You'll notice that it will let me use that photo. I'm sorry, that's a real shocker. Don't need to do anything, don't need to touch anything on the screen. And I'm checked in automatically. So that's a nice way of checking people in without them even needing to touch the screen. Otherwise, we can come in as a first-time user, which I'll quickly sign in. These are the key details we want to collect. And obviously this is really important because when it comes to contact tracing, we can go ahead and pull people's details, which they've entered. I can then select my visitor type, and depending on which visitor type you select, the check-in process it presents can be different. So whilst you might ask a contractor what works they're performing on site, you could ask visitors things like, which resident are you visiting at the aged care facility? So if I quickly check in as a visitor, next step will be to take a photo. So the photo appears on the activity feed. So when people are checking into your site, not only can you see their names, but you can also see a photo attached to their check-in event. So as I mentioned, we can go through some quick screening questions, make sure your visitors understand that. And what happens is if I answer in a way that poses a risk, we can reject the check-in event. So I did a test one earlier where I was answering in a way that said I had symptoms. So I'll show you what that looks like shortly. You know, specific to the aged care sector, we really want to collect those influenza vaccinations. That's an important one. So we've got a workflows module where we can collect those vaccinations, and only if people have uploaded them can you allow them to check into site. Otherwise, they'll be rejected. You can present things like evacuation diagrams here. And then finally, we'll go ahead and sign off. And that takes us to the final stage of the check-in process, which is where the visitor can select a host member that they're there to see. So this is someone that will be notified upon arrival. So if you're checking staff into site, probably not so important to register this, but general visitors, really helpful, because if you ever leave your computer, as long as you've got your phone with you, you'll be notified when someone arrives. So if I select that I'm here to see Emily, a text message is then sent out. That's a really quick demo on the iPad, and just to show you before I finish up the Sign Pro activity feed. Obviously none of the data is stored on the iPad itself, it's all stored via our web dashboard. So you can jump in here and have a look at all those visitors that have signed into your site. So this one's coming up as pending. That was because I answered in a way that posed a risk. Otherwise the rest have been accepted, and you can see who's signed into your site. Cool. Thanks everyone for listening. Does anyone have any questions?
That's awesome, Emily. I'll just jump in because Sign is one of these products that we've seen for a long, long time, because it's in lots of the schools. And, you know, I visit a lot of schools, and it's great because Sign works really well. It's a very clear interface. It interconnects with the Department of Justice, which checks my working with children check. And allows me to enter the premises very well. And it remembers me when I come back. And as Emily said, there is an app which as well can sort of detect when I'm near a school and signs me in automatically. And it's one of these things that, you know, I've had lots of questions over the past few years of, oh, can you recommend a sign-in system? And I've always said, well, it's Sign. We can't sell it, but now we can.
Yeah,
So certainly our team can help you with any questions around this. But also worth mentioning that with Aruba Wireless, there is now an integration, or has been an integration for some time now, with the ClearPass system, which basically means as well, when I enter a school such as Mazenod College, they have got this set up so that I sign in, and then I get a text message that says, well, here you go, you're on the guest network now. And here's your Wi-Fi password, and that goes through texts, and we just log in that way. So it's a great system with integration into other systems. I do have some questions here from Julie. Hi Emily, can this be used for a remote workforce such as home care provider, and can we then use it to screen our clients before we enter the home?
Yeah, absolutely. Great question. And I was just having a conversation this morning with one of our big hospital networks about doing this. So I think they've got about 300 staff that work remotely at the moment, but they're going out to patients' houses. So what we've done is we've set up a working from home remote site for them. They scan a QR code to check in every day, so they can save that on their desktop. And when they're checking in, they're entering the site address or the patient's address that they're going to. So absolutely, we can facilitate working from home solutions. And then from the business's point of view, you can easily go into the activity feed and have a look at your staff that have logged on to work from home.
Cool. I'll keep reading down here. Does Sign enable pre-booking via an online portal or via the app? I.e., can they book an appointment for 2:30?
Yeah, good question. We can sort of do it the other way around. So we can send out invites if we know that people are coming to site, but they can't pre-book. I know we've had a lot of discussion about that, and it's something our engineering team have considered. Michael, you might know if that's had any more traction, but we just haven't had too much demand for it. So at the moment, it's really just we're inviting people to come in.
Also got here, how do you reassure users around privacy considerations with the information collected?
Yeah, great question. And that was where this Australian government COVID app really helped us, because all data is stored with Amazon Web Services in Sydney, same as the AusGov COVID app. So that really helped reassure a lot of people, because I know some of our big defence companies have had some concerns with it. But if it provides reassurance, organisations like Australia Federal Police are clients of ours, and they've been able to overcome any of those issues. So, yeah.
Awesome. And one here, can you set the types of details you want to collect at check-in? How configurable is it? Can we brand it, etc., etc.?
Yeah, absolutely. It's super configurable. So in terms of building those check-in forms, we really work with our clients. If they've got paper-based forms, we can build them into digital forms. And you can set up different questions for different visitor types. So yeah, really easy to program in the fields that you're wanting to ask of your clients, and we can upload multiple choice questions, yes or no questions, images, whatever you're wanting to pose to your visitors, we can definitely facilitate.
Cool. We've got another one here. With limitations on aged care visitations, times and how long, allowing pre-booking would be a key requirement. Oh, this is not really a question so much as a comment. This is part of our current assessment process. That was from Tim Scott. I know that we have just put this in at Mayflower Aged Care. I think it literally went live today or yesterday. So they did a lot of testing and looked at a lot of different systems before going with this.
Yeah, they did. I think a lot of companies will even engage an external consultant to go out and do the research on their behalf and present it back. And thankfully, Sign was the answer they came up with. So I think they did well.
Well said. Emily, TGA approval for the thermal cameras. What's the timeline on those?
Yeah, great question. So obviously, whilst our integrations, our engineering team have been working hard to get them up and ready, the Australian government has stepped in and said that because they're being used as medical devices, they need that TGA approval. So the last time frame that I've been given from our integrators, two integrators being Fleur and Sapio, was about 4 to 6 weeks. But as it is a government approval, we just can't know for sure.
Terrific. Not a question, but a comment. I suppose as a lot of people on this Zoom session are from the aged care sector, I think it's really pertinent to note that, you know, what's coming out of the Royal Commission, which has been around for quite some time, is the adoption of innovative technologies. And Sign is definitely an innovative technology. And most importantly, when you do bring innovative technologies into an environment, certainly in aged care sector, you need to be full 24/7 support. And in collaboration with Sign and Trident, we have been 24/7 for a number of years. And that just kind of stabilises it and gives us the imperative situation in the event there is some form of support requirement where they're 24/7 as what Sign is. So it's a great partnership to work through in the aged care sector. But probably the most important question, Emily, is it Port Adelaide or Adelaide Crows?
Okay, Michael that's sitting here with me is Adelaide Crows. I'm actually a Tigers supporter myself, so.
I'm sorry to hear that. There is a number of people on this call that are very strong Richmond supporters.
Oh, good. They're smart people.
We did actually have another question, which was about pricing. And I know that the pricing can change sort of depending on exactly what solution is put in, but is there a ballpark around this, Emily?
Yeah, so the pricing is based on a per site basis, and then at the site we're looking at the average check-in volumes. That's generally how it would work. Once we start bringing integrations into it, it can change. So those thermal cameras will require our enterprise plans, but otherwise if you're starting with a small plan, you're looking at around $708 a year, and that will allow you to check in up to 25 per day. And then moving up to higher volumes, it really just scales with those check-in volumes. So yeah, we can provide a quote and yeah.
And that's plus the hardware and the...
Yeah, plus the hardware. We can supply all of the hardware as well. So I know that people like to use Sign, I guess, as a one-stop shop. They don't want to have to go to multiple places for software and then hardware. So we can supply those kiosks that I showed in the picture. So the standing kiosks that stand from the ground, otherwise desk stands. So yeah, we've got a few options for hardware.
And it's certainly, from my experience, whenever I've gone to a school and had issues with one of these sign-in products, it's nearly always because the iPad that they are using is one that they had lying around from about 5 years ago, and that's why it doesn't work. So it's it's best to just get the one-stop shop solution here. So that's excellent. Okay.
Okay.
Thank you.
Thanks, Emily, and great presentation. And as I mentioned before, is that we'll share these presentations. And should you want any pricing, just give us a call or your account manager, and we'll work that through. So again, Emily, thanks so much. Before we move on to the next speaker, there is a bit of another bottle of wine up for grabs. If you could just slowly send what you are eating for your Uber Eats, which has been sponsored by Cinex. The most interesting dish will win a bottle of wine. So please feel free to send that on the chat or the Q&A. Okay, moving on. We're on track. I think we're going quite well. We're going to introduce Alyssa McCormack from HP Aruba. Alyssa and I used to work ago many years at another organisation, and she's moved on to be Australia Pacific Region Head Lead Solution Development Architect, and I've just stayed in Brighton. So I'll hand over to Alyssa, and she will no doubt talk about the ability to, once you're in an aged care centre, some of the value proposition that something like HP have put together to assist us certainly in the aged care sector. So over to you, Alyssa.
Thank you very much, Jeff. I'll just quickly get set up here. Okay, I take it that everything is being displayed correctly?
Yeah, it's come up now, yep.
Fantastic. So I thought, so first of all, good afternoon, everyone. I hope you're enjoying your Uber Eats lunch. I haven't had the opportunity to explore mine yet, so that's something for me to look forward to. So I thought today we would spend a little bit of time exploring how we can build upon an investment in Aruba Wi-Fi. And that's really by extending the functionality of the access point and have it assist in public health investigations such as contact tracing. So the primary objective here is to use the data or the intelligence that we're collecting at the edge of the network, aka via the access points that you see here, and use that to support both preemptive planning, such as items like location tracking, but also assist with response techniques such as contact tracing, which I think we'd agree are extremely relevant in today's environment. So essentially, just having a quick look at the architecture here, the access points continue to provide that Wi-Fi connectivity for clients, laptops, handhelds, etc. But what we're doing is we're actually extending that capability so it can now start ingesting data that's coming from BLE wearable tags. So these give us that location information and also allows us to have visibility into who's had contact with someone else within the facility. So I did take the liberty of exploring the government's, I suppose, recommendation report around how to prepare and respond for outbreaks. And I was really interested to understand if there were any areas that Aruba could add value in regards to how to respond to some outbreaks. And I looked through and I identified 4 areas, 4 use cases where we believe that we can actually provide some assistance and add additional value. The first one is around screening. So when I'm speaking about screening, it's not so much as I'm entering into the facility and capturing my details. It is, okay, as a visitor, where am I going in the facility? What spaces am I interacting with? What objects am I touching? And potentially who am I spending time with? The second one is really to look at how we can help with infection prevention and control. And for that, it's really understanding how we can optimize cleaning schedules and also look at ways to give greater visibility into the use of dedicated hand sanitization stations. The third one, which I think is really critical, and it is applicable across multiple organisations, is to identify where people are naturally gathering. Now, if we think about it in an aged care facility, there's 2 or 3 distinct groups. You have the visitors, which would come in potentially to a waiting area. You have the residents that would be using dedicated rooms. We would see them gather in dining areas, potentially in exercise rooms and activity centres. But the one that is a little bit harder to understand and it is probably quite important is to understand where casual gatherings are occurring. So where do people naturally come together? Is it around coffee, tea facilities? Is it in lunch areas? Is it near a bay window that has some beautiful afternoon sunshine coming in? So really giving visibility into those casual cohorts. And then of course the one that is most prevalent, and that is the ability to provide contact tracing. So Emily spoke about providing contact tracing as visitors are coming into the facility, but being able to understand who and what I've been in contact with as I've been going about my day-to-day duties. And of course, all of these are designed to help assist with maintaining the residents' well-being. So let's just double click into some of these. And what I'll do is for the next few minutes.
Your slide pack is not moving though. We've got on the screen floor dashboards 3.19.7.
Oh, okay. So let's change the sharing. Okay. How's that?
Nothing yet.
Nothing yet, all right.
There we go. We've got you. I've got back to you now.
So you should have a screening, managing visitor access.
Yeah, that's it. Perfect.
Okay, fantastic. So we have caught up. So just to so that you can visualize what I was actually speaking about previously, the joys of virtual sessions. These are the 4 key areas that I was speaking to. So as I said, we're going to go through a deeper dive into some of these use cases, and I will break it up by actually explaining what the use case is and then jumping over to a quick demo. So essentially when we talked about managing visitors' access, as I mentioned, the visitors are screened upon entry, so temperatures taken, details recorded, etc. But today, that's where your visibility stops. So our objective here is to give you insight into, okay, how is the visitor actually using the facility? Where are they going and who are they interacting with? So to do that, we would assign a visitor a small wearable tag. And what we're then able to do with the help of the access points is that we're able to then track where that visitor is going throughout the facility, and also how long they're actually spending interacting with different objects and also other people. So in the event that you do receive a request for contact tracing, not only can you give the details of that visitor themselves, but also who they've been in contact with within your facility, and from a proactive perspective, be able to replay where I have been as a visitor in order to facilitate deeper cleaning of those particular areas. So I'm going to just jump now to the contact tracing app. So this is a prototype. So I'm giving you a bit of a sneak peek into some capability that we're planning to release in October. So a couple of things to call out. First of all, I'm interested in humans, but I'm also very keen to understand that human to object interaction. So think of shared areas. It could be couches, it could be coffee tables, it could be wheelchairs, trolleys, etc. To understand how humans are interacting with those objects, and also from a spaces perspective. So if I come back to, and Jeff, I'm going to use you as an example here. Jeff has come in and he wanted to visit his aunt. So he's gone through the registration process. He's been wearing a tag, and now we've received a call to do some contact tracing.
You've
So,
just reverted back to that other slide though. Yeah, you're back to that original, the other screen. So it's got the 3 floors and 19 gyms, 7. It's gone from the other presentation. Okay.
so it's
now,
changed now?
Yeah, now it's got asset exposure. Yep.
Okay, good, good.
Go.
Okay, so what we're interested in a distance. So for Australia, it's 1.5 metres, so a maximum distance of 2 metres, and also the exposure time. These are all variables, so they can be changed to meet your requirements, and then the date. Now, from an asset perspective, what we are encouraging is that we're not actually using people's names. So you won't see Jeff's name listed here, but what you will see is the fact that this is a person, or it is an employee, or it is a visitor, or it is a resident. So maintaining privacy is the utmost importance in this scenario. So I'm going to do a search now on Jeff, because I've been able to trace his tag back to this identity, and we can see very quickly the human-to-human contact, but also interestingly human-to-object contact as well. So we're able to not only do the contact tracing from the human-to-human perspective, but potentially you might want to clean the objects that Jeff has been interacting with, given he's spent a total of 261 minutes. So all of this is downloadable, okay, so it can be handed over to health authorities. But we might also be interested in, okay, well, where has Jeff actually been? So we can then start displaying where he has had the contact on the floor plan. So we'll just extrapolate that out slightly. Okay, so we can see that he's spent the majority of his time down in this area, and this could be the visitors area as he's come into the premise. But if we want to see where he's actually or how he's moved around the facility, we can then go back to a history, and we will search up Jeff's history. Okay, so we'll select Jeff and then select search, and we'll be able to do a playback of where he has spent time within the facility. So as we can see here, we're actually replaying his movements. So as I mentioned before, he spent the majority of time in what could be the visitors area. So we'll be able to be proactive there and give that a much deeper clean. So coming on to our next use case, and this is around cleaning and sanitization. So the ability to have visibility into high traffic areas. So areas that have, they're either carrying a lot of traffic, but a lot of human traffic, or they're areas where people tend to congregate. That is really designed to help tailor cleaning schedules. And the second use case is around the ability to monitor hand sanitization stations. So as I mentioned, because these are tags, we can actually monitor the interaction with objects. So if there is a hand washing station, this is one of the few times where you want high levels of contact, and you want that contact to be 1 to 2 minutes. So being able to measure the utilization of those stations. So let's have a quick look at this top one about which gives us visibility into high traffic areas. Okay, so again, we're going to be interested in from a floor perspective, and this time we're looking at it from a heat map. Okay, so again, I'm interested in the human element of this. Objects will most likely stay fairly static. And what we can do is we can do a replay. So we'll grab the data. Okay, and we have a visual representation of the high traffic areas throughout the facility, and we can then replay that back over time so we can see how that is being used, and then of course the opportunity to adjust cleaning schedules as required. So the next use case is really to be able to understand where people congregate. And as I mentioned, there will be specific rooms that you are already aware of, such as the dining facilities, exercise centres and recreational centres. But to give us visibility into those casual cohorts that are gathering across the facility. And the opportunity here, and we've seen this with a number of the beta customers that we're working with, is the ability to reinforce policy, to re-educate people around the requirements for social distancing, and in some instances even look at the layout of facilities, such as I've mentioned, tea and coffee facilities, potentially reproducing those or replicating those in different areas of the aged care centre in order to encourage people or encourage disbursement. So let's just jump back and have a quick look at the clustering visibility into clusters. So I'm interested in groups or any group of 4 or more people, and within that group, there was a maximum distance between the members of 2 meters. So let's just take a look at what we come up with here. Okay, so as we can see, we're given a time period, so we can see when this cohort got together. We are also given the number of assets. Okay, so when we talk about an asset, we're talking about those tags, because it is the tag-to-tag communication that we're interested in. What was the distance between those tags, and also the list of assets who were together in a cohort. Now again, you won't see anyone's names listed here, and that is to ensure that we're protecting the privacy of the staff and also residents who may be wearing these tags. So that tag to human identification, that would occur in a separate system, whether it be in your HR platform, or whether it be another spreadsheet somewhere, but that is something that is maintained by the facility itself. So in this example here, as I've said, we've got we've identified a number of cohorts, a number of gatherings. So let's have a look and see how they're actually reflected on the map. Okay, so again, it looks like the gatherings have been in the bottom or the lower centre area, which in this case could be our visitors area. And you'll notice that the size of the actual dot is changing. So that's changing to reflect the size of the cohort. Okay, so we can go at, given this information, maybe there's some tea, coffee facilities there that we might want to put somewhere else, make a replica of that somewhere else in the facility, and also maybe additional signage around social distancing, or potentially have someone there for a couple of weeks to be able to monitor and remind people around social distancing. And one of the value adds here, because we go back in time, you can then replay to see if there's been any changes or improvements in adherence to policy. Okay, just coming back to our final scenario. And that is, as I've mentioned, is the contact tracing element of this. So as we've spoken about, this is the same practice that would occur for visitors. A staff member has reported being positive, so a request for contact tracing has been received. The ability to go in and understand who that staff member has been in contact with for, let's say, maybe over 10 minutes and at a maximum distance of 2 meters, to be able to pull up all of those assets and then provide those names back to the contact tracers. And then from a proactive perspective, understanding where they've actually spent the majority of their time within the facility to be able to facilitate deep cleaning as required. So just to give you a little bit of background as to sort of where this solution came from and where we're taking it, we actually started, this solution started out as an asset tracking solution. And we started to hear feedback from our customers that they're planning to return to work and they needed a way to be able to track who the employees have been in contact with. So that we then took that on board, and the other requirement was around ensuring that we're maintaining privacy information. So there were two of the key requirements that were coming in from our customers. So with that, we got together a development team and we put together, had started building out that platform that I was demonstrating with. And then we started to hear, as we were talking with our customers who started using this platform, some of the other capabilities that they were interested in. And that is to not only just do straight contact tracing, but also help me understand how my space is being utilized, so that I, as the owner, I can then make the necessary changes to encourage social distancing amongst employees. And in the aged care sector, it would be more so for visitors and staff members, and then being able to deliver on-screen notifications. So that's where we are today, what you've seen. This will be released in the October timeframe, so we're very close. It will have a refreshed dashboard, and it will also include the workflows for visitors and guests to be able to come into the facility and then reuse those tags after they've been cleaned as well. And from the future perspective, I'd be very keen to hear your feedback. Some of the areas that we're looking at are integration with communication platforms. So think of things like Slack and Teams to be able to send out alerts and also reminders to people, and the opportunity to communicate with the tag holders. So the tag is while it's an active device, it provides a signal back to the access point around where it's actually residing or located within the environment, and its proximity to other tags. So we're also exploring ways to be able to potentially have a complementary app that would then allow the receptionists or HR to be able to connect with people directly, given that the majority of people today do have their phones or some sort of communication device with them. So that's everything that I had for you today. And as I said, I'm very keen to hear some feedback. So Jeff, do we have any comments in the Q&A or in the chat?
Yeah, we've got a couple of questions here, Alyssa. If I use this solution to monitor visitors, will it capture interaction between staff and visitors?
So if the staff are wearing the tags, then yes, it will record that interaction as well. So I think it depends on the use case. If it is visitors that you are primarily interested in, then we can just have the visitors wearing the tags and potentially have also tags in the spaces that they're using. So whether they go and visit their relative and spend time in their room, there could be a tag in that room to show that interaction, or it could be in a public space where visitors tend to gather and congregate. So in that scenario, yes, and also the visitor-to-visitor interaction. If you did want to take it one step further and extend it to staff, then staff would also need to wear a tag so we can track that interaction.
So
Thank you.
just Alyssa, had a couple of questions about the tags, and I think you just mentioned BLE at the start of this. You might just want to mention, explain what BLE is, and also how big are the tags?
So the tags, let me just find. So this is the lid off a vitamin box. They're about yay big. So they can fit on a lanyard. We've even have them been embedded into, so they look like a watch. It's a wearable that sits on the person's wrist. In regards to the communication, it is using a BLE technology, so it is different to Wi-Fi. The access points that that many of our customers have today have this embedded capability to be able to turn on a different radio that communicates with BLE or Zigbee. So BLE is considered a short range communication protocol. As I've mentioned, it is different to Wi-Fi, and we would just enable that on the access points and we could then start tracking.
Yeah, essentially BLE is Bluetooth, which is pretty much what the government app is based on as well. So it's something that we're all pretty used to.
Yeah.
Low energy.
Yes, it is. Yeah, low energy BLE.
Yeah.
I've got what is the proximity range and how does it compare to Wi-Fi based solutions?
Great question, Jeff. So the proximity range for BLE, one of the, I suppose, key functions of BLE is that it is close range. So we're able to get between 1 and 5 meters. Now, that said, there is an assumption that the access points are laid out to support a fairly dense environment. So if there's one access point at one end of the facility and another access point at the other end of the facility, then obviously there's going to be some challenges there. So a sound access point deployment, meaning that there's very few dead spots. We can also use what we term control tags. So they're the same sort of tags, but we have them sitting in key locations to just help amplify the signal. So let me rephrase that, help triangulate the tag that I'm wearing back up to the access point. Now, when it comes to Wi-Fi solutions, as I remember the second part of the question, they're bound by the Wi-Fi's ability to triangulate. So that could be anywhere between 5 to 10 meters. So a Wi-Fi solution or a Wi-Fi based contact tracing solution is where it's good for environments where you're just looking for a range. I was in the vicinity of, I could have been 5 or 6 meters away, but I'm still in the vicinity of that person. If you're more interested in, okay, I need to know exactly or a closer understanding of who I came in contact with, then something that is BLE based is preferable.
Okay, thank you. There's one there from Luke. If we have laptops that are in ClearPass and Airwave, which also tracks their location, can we add, can we add this location data to the platform?
So it wouldn't be added to Airwave. Airwave is a network management platform.
Yeah.
It would be presented as a separate dashboard. As you saw here, it's a web-based interface, and it would then, the data from the tags are treated as a device that is connecting to the access point. So given it's BLE, it wouldn't be tracked by Airwave. All of that would be managed through the dashboard.
But Luke, I think that dashboard is in Aruba Central.
No, it's not. So
Oh,
this is
okay.
actually sitting outside of Aruba Central. Our Wi-Fi based solution is hosted within Aruba Central. We've decided to keep this separate because customers may or may not have invested in Central. So this is actually sitting outside. It will have the same look and feel. So for those who are familiar with Central, it will end up looking very similar to it as far as menu options and the way to navigate.
Okay.
Okay.
Is this live, Alyssa? Is this live data, or is this for something to go and look back later to find out where the person's been?
This is, thank you so much for the reminder. This is actually live data. So I'm at our Portland office at the moment, and I do have the opportunity to view what is happening at that Portland office now. So as we can see here, we have a number of objects that we're tracking. Okay, and also people. Now, given it would be extremely late, I don't envisage that there would be too much activity here, but it certainly, so some people are still in the office, so it certainly gives you visibility into what's happening in the facility near real time. There's about a 1 to 2 minute lag.
Excellent.
Terrific. Okay, Alyssa, thanks so much for that. It was a great presentation, and we'll wrap that bit up. So again, thank you. I'd like to thank all our keynote speakers, Lior, Emily, and Alyssa. I think the content was really relevant for our, the audience and where we are in our in the environment. So thank you all very much. Okay, we did have a little contest. Who had the best Uber Eats? We've had hamburger, we've had lamb curry, bento box, miso sama, dare say Johnny, that's from the pantry. But the winner will be Rhonda Withers, who had a Lumi Salables. If you can send us your details, Rhonda will get you a nice bottle of wine. So lastly, I'd certainly like to thank Cinex, our sponsor, for assisting us putting all this together, and all our keynote speakers. And as we will send this the pack round to all attendees, and if you're after any specific information, give us a buzz and we'll get back to you. So again, have a great weekend. Thanks for your support. We'll see you at our next session. Thank you.
Thanks, everyone.
Thanks, everyone.
Bye.
Thanks, Gavin. Thanks, Jeff.